Every single day, millions of seniors check their blood pressure, look at those two numbers, and focus on the wrong one. Their doctor has never corrected them. Their pharmacist has never flagged it. And the number they are ignoring is quietly doing damage to their brain, their heart, and their kidneys while they feel completely fine. I need you to stay with me for the next few minutes, because what I am about to show you is one of the most important and most misunderstood things in senior health. And if you have been told your blood pressure is okay for your age, this video may change how you think about that forever. I'm Dr. Hayes Anderson, and after 22 years working with seniors, I have sat across from patients who did everything right. They checked their blood pressure faithfully. They took their medication. They followed the rules. And still, some of them had strokes. Some of them developed heart failure. Some of them lost kidney function slowly and silently over years. When I looked at the full picture in those cases, the pattern was almost always the same. They were watching the wrong number, and nobody had ever explained why that mattered. By the end of this video, you will know exactly which number is the real threat after age 65, why it becomes more dangerous the older you get, and what you can do starting today to protect yourself. I am also going to introduce you to a concept that almost never comes up in a routine doctor's appointment, but that tells the truest story about what is happening inside your arteries right now. Stay with me, because this one is worth every minute. Let me start with the basics, because to understand the danger, you have to understand what those two numbers actually mean. When the cuff tightens around your arm and releases, it is measuring the pressure of blood pushing against your artery walls. But your heart does not beat at a constant, steady pressure. It pulses. It squeezes and relaxes, all day and all night. And that is why you get two numbers. The top number is called systolic pressure. It is the peak force of blood pushing outward when your heart contracts and pumps. The bottom number is called diastolic pressure. It is the resting pressure in your arteries between heartbeats, when your heart is relaxed and refilling. For decades, doctors treated both numbers as equally important. If either one was elevated, you had high blood pressure and you needed treatment. But over the past 30 years, as large long-term studies tracked millions of people and followed who had heart attacks, who had strokes, and who died from cardiovascular disease, a pattern emerged. A clear, consistent, undeniable pattern. And it changes everything for anyone over the age of 60. Let me tell you about Harold. Harold was 73 years old, active, careful, disciplined about his health. Every morning he checked his blood pressure, and he was proud of what he saw. His bottom number was consistently in a healthy range. He came to appointments and reported it confidently. His diastolic pressure was fine. What neither Harold nor anyone around him was tracking closely enough was his top number. His systolic pressure had been quietly creeping upward for 3 years. 140, 145, 150. Each time he was reassured that a little rise in the top number is normal with age. Until one morning, Harold collapsed from a stroke that nobody saw coming. Harold's story is not rare. It is one of the most common stories in senior medicine. And it starts with a misunderstanding that most people carry for decades without ever being corrected. Here is the truth. After age 60, your systolic pressure, the top number, becomes far more dangerous than your diastolic. Research from the Framingham Heart Study, which followed thousands of people for decades, showed that systolic pressure is 2 to 3 times more predictive of heart attack and stroke risk in older adults than diastolic pressure. 2 to 3 times. And yet most seniors, when asked which number they watch, point to the bottom one. So why does the top number become so much more dangerous as we age? The answer lies in what happens to your arteries over time. And this is the part that almost no one explains clearly. Your arteries are not rigid pipes. When you are young, they are elastic, flexible tubes that expand slightly with every heartbeat and then recoil. That elasticity serves a critical purpose. It absorbs the peak force of each contraction. It smooths out the pressure wave. It protects your organs from being hammered with every beat of your heart. But as you age, the elastic fibers in your artery walls break down. They are replaced by stiffer collagen. Calcium deposits begin to accumulate. The arteries gradually lose their ability to expand and recoil. They become less like rubber bands and more like plastic tubing. When your heart pumps into stiff arteries, there is no give, no absorption. The peak pressure spikes higher than it should with every single beat. That is your systolic number rising. And it rises not necessarily because your heart is working harder or because you are eating poorly. It rises because your arteries have stiffened with age, and that stiffening is compressing all of that force into a pressure spike that hits your brain, your kidneys, your eyes, and your heart with every single heartbeat, thousands of times a day, every day. Think of it like waves hitting a seawall. A few waves do no damage, but thousands of waves, day after day, year after year, begin to crack the wall. That is what sustained high systolic pressure does to the delicate blood vessels in your organs. It creates microscopic injuries. Your body tries to repair them, but the repair process creates more stiffness, more inflammation, more narrowing. And the cycle continues silently, often with no pain, no warning, and no obvious symptoms at all. That is why blood pressure is called the silent killer. Not because it kills loudly, because it kills slowly, quietly, while you feel fine. Now here is something I need you to understand, because this is where the real confusion lives for most seniors. Just because your diastolic number, your bottom number, looks reasonable, does not mean your blood pressure is under control. I have seen patients walk into my office with a reading of 158/74 and say, "Well, my bottom number is good," and they are genuinely surprised when I tell them that reading is dangerous. They were watching the wrong number the entire time. But I want to be careful here, because the relationship between these two numbers is more complicated than simply saying the top one matters and the bottom one does not. There is a concept I want to introduce you to that your doctor almost certainly has never mentioned. It is called pulse pressure, and it may be the single most revealing number on your blood pressure reading. Pulse pressure is simply the difference between your top number and your bottom number. If your blood pressure is 150/70, your pulse pressure is 80. If it is 140/85, your pulse pressure is 55. That gap, the distance between those two numbers, tells a story about the condition of your arteries that neither number tells alone. A wide pulse pressure, generally anything above 60 in older adults, is a direct sign of arterial stiffness. It means your arteries are not absorbing the force of your heartbeat the way they should. It means that peak pressure is spiking high and the resting pressure is relatively low. And research has shown that wide pulse pressure is independently associated with higher risk of stroke, heart failure, cognitive decline, and cardiovascular death in seniors, even when both individual numbers look acceptable on their own. Let me give you a real example of why this matters. A reading of 150/70 and a reading of 140/90 tell very different stories. Most people would look at those two readings and say the second one is worse because the bottom number is higher. But in seniors, the first reading, with its wide pulse pressure of 80, may actually carry more cardiovascular risk. The stiff arteries it reflects are doing more damage every day. The person with 140/90 may have more conventional hypertension, but healthier, more flexible arteries. This is why a single number, even the top number, does not tell the whole story. You have to look at both numbers together. You have to look at the gap between them. Let me tell you about Eleanor. Eleanor was 77 years old, a retired librarian from Ohio, the kind of woman who read 2 books a week and remembered every detail of both. She had been on blood pressure medication for 8 years. Her readings looked fine to everyone. Her systolic was controlled. Her diastolic was reasonable. But over the past 2 years, Eleanor had noticed something. She was struggling to recall words mid-sentence. She would start a thought and lose it before she finished. She had begun keeping a notepad in every room because she could not trust her memory to hold information from one room to the next. Her family was worried. Her doctor had run tests and found nothing obvious. When I reviewed Eleanor's blood pressure logs from the previous 2 years, I noticed the pattern immediately. Her pulse pressure had been gradually widening. It had gone from a gap of about 50 to a consistent gap of 75 to 85. Her systolic was controlled on paper, but the widening pulse pressure was telling a different story. Her arteries were stiffening progressively, and despite the medication, the pressure waves hitting her brain's delicate blood vessels were increasing in force. We worked with her physician to adjust her treatment approach, focusing specifically on arterial flexibility alongside pressure numbers. Over the following months, her pulse pressure narrowed, and Eleanor told me 6 months later that the word-finding difficulty had noticeably improved. She was not back to where she had been 5 years ago, but she had stopped getting worse, and she had started getting some of herself back. Eleanor's case is a reminder of something I want you to hold on to. Memory loss and cognitive decline in seniors are not always what they appear. Vascular causes, driven by years of pressure damage to the small blood vessels feeding the brain, account for a significant portion of what gets labeled as simply getting older or even early dementia. And in many of those cases, the warning was there in the blood pressure readings all along. It just was not being read correctly. Now I want to talk about the morning, because there is a specific time of day when your systolic pressure does something that most seniors have no idea about, and it matters enormously. In the hours just before and after waking, the body goes through a hormonal shift. Cortisol and adrenaline rise to prepare you for the day. Blood pressure surges. In healthy younger adults, this surge is modest and well managed. In seniors with arterial stiffness, this morning surge can be dramatic. Systolic pressure can spike 15, 20, even 30 points higher than it runs during the day. Research has shown that this morning blood pressure surge is one of the strongest predictors of stroke risk in older adults. Strokes happen more frequently in the morning hours than at any other time of day, not because of coincidence, because that is when the pressure on stiff, vulnerable arteries is at its highest. If you only check your blood pressure in the afternoon or evening, you may be missing the most dangerous reading of your day entirely. Let me tell you about James. James was 71 years old, a former high school football coach, still physically active, still sharp. He had been managing his blood pressure for 4 years and felt he had it well under control. He checked his readings regularly, always in the evening after dinner, and they were consistently good. One morning, James woke up with a severe headache. By the time his wife called the ambulance, he had lost movement on his left side. He survived, but his recovery was long, and his life changed significantly. When his medical team reviewed his blood pressure data and began checking morning readings, they found that his systolic was consistently 30 to 35 points higher in the morning than in the evening. His evening readings had told a reassuring story that was not the full story. The mornings, unchecked and unmanaged, were where the damage was happening. James's case changed how his entire care team approached blood pressure monitoring for their senior patients. Morning readings matter. They are not optional. They are where the real risk lives for many seniors. So here is what I want you to take away from everything I have shared today. And I want to make this as practical as possible, because understanding the danger is only useful if you know what to do with it. First, start paying attention to your top number, your systolic pressure, as the primary indicator of your cardiovascular risk. If it is consistently above 140, that is a conversation you need to have with your doctor, regardless of what your bottom number looks like. Do not let a normal diastolic reading create a false sense of security. Second, calculate your pulse pressure. Take your top number and subtract your bottom number. If that gap is consistently above 60, bring it to your doctor's attention. Ask about pulse pressure directly. Ask what it means in the context of your age and your health history. Most doctors will appreciate the informed question, and it will lead to a more complete conversation about your actual risk. Third, check your blood pressure in the morning. Within 30 minutes of waking, before coffee, before medication, before you have been active. Take 2 readings, 1 minute apart, and record both. Do this for 2 weeks and bring that log to your next appointment. Morning readings are the most clinically meaningful readings for stroke risk, and they are the ones most commonly missing from a senior's health record. Fourth, do not rely on clinic readings alone. Blood pressure in a doctor's office is influenced by stress, by travel, by time of day. Home readings taken consistently at the same time each day give your doctor a far more accurate picture of what your arteries are actually experiencing every day of your life. Fifth, ask your doctor specifically about your systolic target for your age. Current evidence supports different targets for seniors than for younger adults. If you are over 70, the appropriate systolic target for you may be different from what was set when you were 55. That conversation is worth having, and now you have the language to have it. I want to end with something that I tell patients who come to me feeling overwhelmed by this information. Finding out that you have been watching the wrong number is not a failure. It is not your fault. The way blood pressure has been communicated to patients for decades has focused on both numbers equally, without explaining how the relationship between them changes with age. Most people were never told. Most doctors in a 12-minute appointment do not have time to explain it, even when they know it. But you know it now, and that changes everything. Because the damage that high systolic pressure and wide pulse pressure causes is not inevitable. It is not something you simply have to accept as part of getting older. It can be monitored. It can be managed. It can be slowed. And in some cases, with the right combination of lifestyle changes and properly calibrated treatment, it can be meaningfully improved. Harold could not get his stroke back, but you are watching this video before that happens to you, and that means you still have time to act on this information. I have one question for you, and I want you to answer it in the comments right now. When you check your blood pressure, which number have you been focusing on, the top or the bottom? Write it below. Because the answers I see there tell me exactly what most seniors are missing, and your response might be exactly what someone else scrolling through the comments needs to see today. If you have a spouse, a parent, a friend over 60 who checks their blood pressure regularly, please share this video with them. The number they are watching may not be the number they should be watching. That is a simple thing to know, and it could change the course of their health entirely. In the next video, I am going to show you 5 specific lifestyle changes that research shows can lower systolic pressure without medication in seniors, including one that most people have never heard of and that can produce measurable results within 2 weeks. You will not want to miss that one.